Well, that gives us a perfect interlude for an inspirational story. Our canine companions thrive on movement and good exercise. So when this can no longer happen due to problems with their hips, it's a very painful situation for the dog and, of course, for the owner on the emotional front. Fortunately, though, dogs benefit from modern medicine, and sometimes the best solution is a hip replacement.
Every day in South Africa, vets will diagnose and treat some common conditions that occur in dogs. One of these medical conditions is hip dysplasia, which can severely impact a dog's mobility.
The hip dysplasia is essentially an inherited condition of the hips. So instead of having a nice ball and socket that fits tightly together and is congruent, these dogs, as they grow, develop a hip that is incongruent. The socket is somewhat shallow, and the head or the ball of the socket is misshapen, and that creates some friction in the joint. It tends to load all the weight over a fairly small portion of the joint, and that causes cartilage damage and ultimately inflammation and pain. A dog is essentially programmed to develop hip dysplasia. Until we have some more accurate DNA testing that we can actually test for the genes themselves, we're going to have a fairly limited success rate in eliminating the disease from dog populations. But by screening the parents, we can reduce the incidences. Hip replacement is considered to be the gold standard as far as hip dysplasia is concerned, because in the vast majority of dogs, you will get a situation in which we can return them to normal function and give them a completely new lease on life.
A canine hip replacement is only done on dogs who are in good health and are at least 1 year old. It's a complex surgery, but it can transform a dog's life, as it did for Oscar.
Oscar's 7 years old. He's just really part of our family. He's like a little person, you know. He makes himself known, he's very vocal, he likes to play. We noticed he was battling to walk properly, if you like. There was a sort of hobbling effect happening out on his walks, and that was the end of 2014, December. We treated him with massage and various therapies, and then realized actually there's a bigger problem, and at that point we went to see Dr. Gray.
Oscar already had a history of hip pain on and off, and he was managed as far as possible with medication and rest and so on. But he didn't respond to that, and so we decided that a hip replacement would be the best option for him.
When we realized he had to have the surgery for his hip, we were obviously really upset. I was quite taken aback. I think the phrase that hit me the most was when Dr. Gray said, you'll have to try and keep Oscar quiet for 6 weeks. And that was, no, that could not happen. He's just so lively. But actually then in rationalizing it and in doing our research, we had a lot of support in terms of how we would practically handle the surgery.
We will cut the ball of the ball and socket joint off because that ball is diseased, and we will then just drop down a artificial ball into the bone. And then on the pelvic side, we will deepen that socket, and we will put an artificial socket in there to take its place. So we've essentially got a completely artificial joint that kind of rotates like that and usually provides for near perfect function. Here we have an X-ray which shows his hips before his first surgery, and we can see that he has very, very shallow sockets, and the ball of the socket hardly fits into the socket at all. And there he has artificial hips on both sides, and he should have good function with those hips for the rest of his life. They will usually last 10 to 15 years.
Since his operation, we've seen quite a few changes, and the amazing change is that he's walking beautifully.
To achieve this result, it took a lot of care and post-operative therapy, which you'll see in the second part of Oscar's amazing story.
When he's healthier, he's happier, and a dog's tail never lies. Give him the Science of Happy, found in Hills, the brand recommended by vets worldwide.
Wow, so as we've just seen, obviously a hip replacement, as is the case with humans, is very invasive for our pups to go through as well, and it requires a lot of physical therapy afterwards, a lot of rest, and of course the right nutrition. We want to see them back on all 4 legs again and playing and doing what dogs absolutely love, like our espresso pups.
After beloved pet Oscar had both his hips replaced in surgery, the most challenging part of his journey was recovery, and it's a team effort to ensure proper healing.
The most important thing in the immediate post-operative period would be to confine the patient. So we need the owner to be part of the team, really, and to assist us in keeping them confined and allowing the initial healing to occur. Then we would begin a gradual and structured exercise regime to build those muscles up, to build up the muscle support and to get the dog back to normal function. And for that, we rely very heavily on rehabilitation centres.
The bit after the surgery is the challenging aspect to this, in that, you feel you don't know how to handle him. For 6 weeks he can't really weight bear. You have to help him up with a belly sling. A lot of practical issues that we were quite daunted at. And with Pet Wellness, it is amazing. There isn't one person who doesn't put heart and soul into bringing and restoring health back to an animal.
Oscar's treatments all combine together to make him stronger, healthier, and able to use and weight bear on his limbs correctly. Oscar gets hydrotherapy to walk against the resistance of the water to bulk up his muscles in the hindquarters of the operated area. He's 38% weight bearing, so exercise is more tolerable for him through the resistance of the water. He has acupuncture that Dr. May does. Only vets are allowed to do acupuncture, and that targets the deep-seated pain and spasm and tension that you can't get with just normal soft tissue massage. We also do stretching and passive range of motion. Those are all important for strengthening for him. We use the green balance wobble board for Oscar specifically to activate his core muscles. That's the largest muscle in the body, and if that's functioning optimally, then he'll start using his limbs in the correct range of motion. Oscar uses the Cavaletti rails to pick up in place, and that helps him just to create hind leg awareness, but also activating his hindquarter muscles. We use the laser on Oscar specifically for pain and inflammation. It can target deep tissue in a short amount of time. Our laser is a class 4 companion laser, and it really helps with tissue healing.
All the therapies are really integral to the success and the outcome to the surgery. I'm very mindful about making sure that he's not overweight, which is why Hills is really good, because it gives you the exact volume of food that he should be taking in for his weight.
Good nutrition and weight management is vital for dogs with joint concerns, as excessive weight places strain on the joints. Over 90% of hip replacements are successful with a good post-operative treatment plan and teamwork between the vet and loving owner.
Our hopes for Oscar moving forward is simply that he lives his best life. He's a happy chappy, he doesn't have any pain, and he's just really returned to what he was like, funny, entertaining, he loves the outdoors, and he's great. It doesn't even look as though he's had 2 major surgeries.
When he's healthier, he's happier, and a dog's tail never lies. Give him the science of happy, found in Hills, the brand recommended by vets worldwide.